And Dr. Femi, a family medicine consultant from Burkina and Havering University of London, joins me to the schools, the World AIDS Day. It's good to have you join us at this time.
Thank you.
So you are a family medicine consultant. Often, the first point of contact for this patient. From your clinical experience, what patterns are you observing in how, people present with HIV/AIDS today compared to what we've seen in the past few years?
I'll say thank you for inviting me to be part of this discussion today on HIV. And I'll say that with regards to UK, where I work, when we see HIV patients, they are usually very stable and absolutely asymptomatic, and possibly unless they tell you that they have HIV, or maybe you personally have access to their record, like most of the time I do, before you can even have an idea they have HIV. They are because apparently, on overall, the UK apparently is has this very well-funded health system. So people have access to drugs, have access to care, have credible support. So it might be difficult to use what we call yardstick for safety and patient welfare and care in the UK compared to any country in Africa.
And in the past few months, we've seen a reduction in funding, especially from the United States to some countries in Africa. South Africa, one of the countries that has the highest number of HIV cases, has complained now that there is a reduced level of, diagnosis, testing and drugs for some of their patients. Nigeria also affected by this. But how important would you say, early testing in primary care is, very important to handling this crisis?
Absolutely irreplaceable. When we say early detection, people should get themselves tested as soon as possible, or as soon as they possibly have any exposure, maybe like sex with a new or undiagnosed partner, or maybe they have a blood transfusion, or maybe or any of those risk factors that predisposes people to HIV and AIDS. Early testing is one of the game changers that cannot be put aside. So, like I will possibly say that it's one of those advice that we give to patients, that get yourself tested. But it's difficult, especially with the US pulling major funding from the US AIDS. African nations are most likely going to be the ones affected. And so, like, I heard the news when the First Lady of Nigeria was saying that people should start looking inward. That will still be my advice, that inward looking and seeing where we can make some changes and where we could create some tools that could help with their early diagnosis and management can be very useful. That will still be my advice.
So let's talk about stigma. That is another conversation around this. Despite years of advocacy, awareness, we still see that stigma around this still remains high. What new strategies would you say, should be deployed to address this discrimination in homes, workplaces? We still have some, companies who put this as part of their pre-employment policies. Despite, saying they're inclusive, some persons don't get the job after they are tested positive.
Yeah, it's pathetic because like any chronic ailments, we have diabetes, hypertension, something like even those are illnesses that are likely going to be there for a very long time. So HIV apparently falls into that category. And we've seen situations where people have successfully suppressed the state, like when I was using our own situation here in the UK to as comparison. And in most cases, most of the time, the problem with stigmatization is ignorance. By the time you understand that HIV cannot be transmitted by shaking hands, by sometimes sharing cups, by some of those things that even hugging, kissing, HIV is not transmitted through most of those avenues. So in that way, it will help you understand that by maybe an HIV person coming into the room and everybody running away, eventually those are the kind of information that are missing. And sometimes you go into HIV clinics, you hug patients, and if permitted, in some cases, those are not things that's going to make you get HIV. But in a way, it may be a bit. So you might look at it that the discrimination, because the whole aura of HIV, not curable, this, that, and all of that that came with the initial the whole initial aura of HIV. So, but it's going to take a while for people to understand that it's not as we used to think, that medical service, medical research has made credible advancement, including the 6-monthly injection that is now made available for people with HIV that can significantly suppress the replication of the virus and make them as close to as normal as possible, like any other person.
So let's talk about, mother-to-child transmission. That's another concern that has been raised in the fight against, reducing the number of cases. How well will you say Nigeria is performing in that aspect, deploying strategies that will reduce the rate of mother-to-child transmission of HIV?
I'll say that with regards to cases of known HIV that are being managed in tertiary centers like teaching hospitals, there has been because of the awareness and the credibility of information, there's strong effort to reduce the mother-to-child. And one of the significant factors that reduces the mother-to-child transmission is access to drug, early detection. Some of those things we mentioned earlier. If those things are in place, then there's a very large possibility that because of the significant reduction in the viral load, the child of an HIV person might not end up having the disease. But like I said, with the funding drying up, with local effort not at any credible level, it's still going to be a big problem. But we hope that if there are charitable organizations, people of goodwill that are going to support, those are the kind of people we should call to say that this is a significant problem that needs a consensus effort to drive it to a reasonable conclusion. Our aim will be to embrace anybody that can help, so that people affected or children unborn to HIV persons might have a chance of a credible life.
And the advocacy continues. We've seen the federal government, supporting this movement with an extra $200 billion to help, AIDS patients in Nigeria. But that's a fine place to leave the conversation for now. Thank you for talking to us, Dr. Femi Oyekon, family medicine consultant from Bakering and Heaven University of London. Thank you for joining us on World Now.
It's my pleasure. Thank you for inviting me. Thank you.
With that touch on World Now, for more updates on the stories we're monitoring, you can visit our website on www.tvcnews.tv. You can also follow us on our social media handles, Facebook, Instagram, and on X at TVC News NG. We also have updates for you on WhatsApp and Telegram at TVC News Nigeria. On YouTube, we are live at TVC News Nigeria. I am Olamide Adeyemi. Thanks for watching.